Good evening. I will now call the September 10th, 2024 Bermuda Run Town Council meeting to order. Reminder for everyone to please silence your phones. I want to recognize we do have a quorum tonight. We have one vacancy in our council, and Councilmember Tedder is unavailable tonight. We'll start first with the Pledge of Allegiance. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. It is the intent of the Town Council to make solemn the proceedings of this meeting and the business brought before the governing board, to offer the opportunity for a reflective moment of silence. Please join me in a moment of silence. Thank you. Item number 4, Town of Bermuda Run Code of Ethics and Voting Procedure. Mr. Williams.
Thank you, Mr. Mayor. Good evening, Council. Pursuant to North Carolina General Statutes 168-86 and 160D 109 and the Town of Bermuda Run Code of Ethics policy adopted November 9th, 2010, and further endorsed on August 9th, 2022, I would ask each of you before you adopt the agenda if there is any actual potential or perceived conflicts of interest with respect to any matter on the proposed agenda which will come before the Town Council for a vote at this meeting tonight. If so, please speak up and let the Council know at this time before the agenda is adopted. Seeing nothing, Mr. Mayor, as to voting, as we've talked about in the past, when there's a vacancy, it's not dissimilar from any other time under 168-75. If there were to be a tie, the mayor would vote in the event of a tie. There's a few more particulars on an ordinance having a first effect of introduction, but none of that's on the agenda tonight, so we won't delve deep into that, a little deeper water. So, but basic rule, mayor would break a tie, vote.
Great. Thank you, Mr. Williams.
Yes, sir.
Item number 5, adoption of the agenda. The council has had an opportunity to review the agenda. Are there any revisions, or do I have a motion to approve?
Approved.
A second.
Motion by Mr. Ernst, second by Ms. Schaefer. Show of hands, approval. Motion passes 3-0. Thank you, council. Item number 6, approval of the August 13th, 2024 Town Council meeting minutes. Council has an opportunity, had an opportunity to review the minutes. Pardon me. Are there any revisions, or do I have a motion to approve?
Motion to approve. A second.
Motion by Nelson, second by Schaefer. Show of hands, approval. 3-0. Thank you, council. Citizens' comments. So we have one individual who signed up. I know that individual has been here but stepped away. What I'm going to do is I'm going to go ahead and proceed with the agenda, and when the individual comes back, offer that individual the opportunity to go ahead and speak at that point, rather than disenfranchise someone who's had to step out of the room. So with that, we will move to item number 8, Suzanne Wright, Davie County Department of Health and Human Services. As I ask Suzanne to come forward, I'll remind our audience, the council is welcome to ask questions of Ms. Wright. We will not take questions from the audience. This is our protocol for town council meetings. Mr. McCorkle, we'll go ahead and let Ms. Wright complete her presentation, and then I will bring you up for your citizens' comments from a sequencing standpoint. If you have questions, I encourage you to reach out to Ms. Wright directly. So with that, welcome.
Thank you. I appreciate the invitation, and I've been looking forward to this conversation because you and I had a very pleasant meeting about 3 months ago now.
Several months ago, right?
Yeah, and so I think I think everybody got to learn something that day. I got to learn a little bit more about Bermuda Run. I think you learned a little bit more about Health and Human Services. I do this a lot with pictures, so I don't know if you're going to be able to face the screen or not. This is the presentation I do with all new hires. Every new employee that comes on with the county, we have a new hire orientation, so they go through this process with us so that they can learn a little bit about what happens in Health and Human Services and how we all interconnect, how we work together on a lot of things, but also where to refer people if there's something they need from Health and Human Services. So again, I'm Suzanne Wright, Health and Human Services Director for Davie County, and Andrew. So back in 2018, the commissioners voted to consolidate several county departments into one. So they voted to consolidate 5 different departments into one consolidated Health and Human Services agency. Since then, one of those has been taken out, and that was Veteran Services. But it was Social Services, Public Health, Domestic Violence, and Senior Services. So we had to break that down a little bit further because Social Services is a pretty good-sized department, and they have a lot of different programs and services. So we divided those out into divisions. So there's a division of Child Welfare, where we focus on child protective services, foster care, and in-home services. We also have an adult protective, economic, and child support services. That's a whole different division. A division of aging and adult services that has senior services and Davie Center for Violence Prevention. And then the division of public health that has our clinical services, environmental health, and employee wellness. And so, Andrew. So I'd like to start with what environmental health does. And I appreciate you putting my notes up there. I appreciate that. So environmental health is a unit within the Division of Public Health. They are agents of the state. While they're employed locally, they are agents of the state. They get all their training and their authorization, their delegation of authority from the state, but they're county employees. So just wanted to let that out right off the bat. So if you look at the pictures, they do a lot more than just septic systems. So people don't typically realize that. So they permit tattoo facilities in the county. They do all the restaurant inspections, the mobile food units. I think we've gone from 5 to well over 25 now. So food trucks are picking up in this county. They inspect all the public pools. I think there's some here that they inspect. The water park. You see the cafeterias there. They do all the school systems. They work with the daycare centers, the hospital, any place that serves food that's not packaged, our environmental health specialists work with. Even in the grocery stores, the delis. And you see over there the septic system lines and the wells. So they're responsible for all those pieces, not just the septic system piece. Up in the top, you will see 2 UTVs there. We had a grant recently and purchased 2 UTVs because our folks have to go out on big pieces of property quite often. And so somebody will decide to build right in the middle of that big piece of property. And they have a whole lot of equipment to carry with them. And so to keep from having a lot of workers' comp claims, from carrying a lot of equipment across some rough terrain, we use those grant funds to purchase 2 UTVs. So you might see them riding around in developments or on large pieces of property with those UTVs. The dog up in the top corner, we'll come back to that. I'll tell you more about that in just a few minutes. So we also have a full pediatric clinic through our health department. If you see the Novant Health bus up there, we do a lot of screenings. We do a lung bus, lung cancer screening, mobile mammography. But we also have full-blown lab services, a pharmacy on site. And this clinic, too, is fully, anybody can come. We accept all insurance types, but we also have a sliding fee scale. So if people do not have insurance, they're self-pay, we make it affordable for people to come. You see the pregnant lady laying there. We are the only OB provider in Davie County. Maybe we can work on something with Bermuda Run and the hospital to work on getting an OB here. But right now, if an individual is pregnant in Davie County, they either go to another county, to Forsyth or Rowan, Iredell, one of our bordering counties, or they come to the health department to be seen for their prenatal care. Do all immunizations. Like I said, we have a full-blown pediatric clinic, 2 pediatricians on site. We have a nurse practitioner and a PA that work in there. So just a lot of good clinical services. You'll see Contegra Health, you'll see that picture. We are co-located with a federally qualified health center. So they do all of our adult primary care. We felt the need to bring on this partnership because Storehouse for Jesus in this county is fantastic, but sometimes you need health care more than the days that they're open. So to supplement what they're already providing, we have other health care for adults on the days that they're not open. If you look right beside the heart there, you'll see some folks covered in personal protective equipment, the hoods, the mask, the full outfit. A few years ago, we got a call from the state. It's back when the Ebola outbreak was so big, and folks from Samaritan's Purse have been flying in and out. We got a call from the state to say that we had a traveler coming back, and they would be staying in this area, specifically in your area here. And they would need to be monitored while they were here because they had been exposed. So that's the kind of outfits that our staff would wear to go monitor and keep track of that individual while they're here to make sure that they didn't go anywhere or expose anybody if they were sick. So I also ask our new hires, I'm like, all right, true or false question. You don't have to answer. I just want you to have this in your head. So true or false, this is a picture of the Walmart parking lot on Black Friday. That is false. That is what was waiting for us every single morning of the COVID vaccine clinics. So for 6 months, that was our work spot. So even though we have a facility on Farmington Road, our work spot was right there in the parking lot at the community park at Parks and Rec. Usually about 2,000 people were sitting there waiting on us when we got to work every morning. So also in our department there, we have a WIC program. It's for women, infants, and children. It's for pregnant women, breastfeeding, or postpartum, and any child birth to 5. It's a supplemental nutrition program with healthy foods. You see Food Line up in the corner. We have 8 vendors in the county. Last year, WIC participants cashed in about over $700,000 worth of healthy benefits at our local grocery stores. So that's a number that most people don't realize either. We also, through Health and Human Services, have Davies Center for Violence Prevention. Last year, they did over 1,000 protective and restraining orders, did advocacy for over 500 people, provided some shelter. And as you know, as you've read in the paper, we've had too many deaths related to domestic violence in the past year. So our folks are working really hard to prevent that from happening moving forward. And then senior services. I don't know if I can say enough about senior services in Davie County. Kim Shusky, has been the director there for 30-some years. She just recently retired, so we're in the process of trying to figure out who is going to run senior services. But man, what a program she built and developed. But we provide about 51,000 meals a year between the congregate meals that are happening on site. You see the couple up in the top right-hand corner. They come on site to have lunch every day. There's about 38,000 Meals on Wheels delivered every year. And that's tremendous, 38,000. And that means that the homebound individuals in this county are being checked on. They're getting the nutrition that they need through the Meals on Wheels, but they're also having somebody lay eyes on them. That's the biggest thing, because a lot of these individuals live by themselves, can't cook for themselves, and may or may not have family close by. So that's a tremendous program. I have to give credit to our Sheriff's Department. Our Sheriff's Department does a lot of those Meals on Wheels deliveries while they're out doing patrol. So that's another piece where our folks work together quite a bit. Senior Services provides tax aid, free tax assistance. They had about 230 senior games participants last year, and they did a partnership with the library to do computer labs for seniors too. So this is a pretty active senior center for Davie County, so excited about that.
Real quick call out, for anyone that notices up in the upper left corner, you may recognize the gentleman with the apron on. Some of you have a vague memory of him. Mr. Former Mayor Rick Cross serves as the chairman. of the Senior Services Advisory Committee. I'm honored to be a part of that committee.
Yes.
And that picture is an example of the kinds of things that he quietly did behind the scenes in providing various volunteer activities while he served and even since he served, continuing to do things in the community. So a shout out to our former mayor. We nickname him the Angry Resident now.
The Angry Resident.
So that's the new nickname. But just a shout out that of what all that Rick does.
Well, I'm
And
glad
still-
you brought that up because I'd planned to mention that too, but he's been fantastic. And I will say the majority of the time when I see him, it's usually in a volunteer capacity.
Right.
He walked the pavement with me at the COVID clinics, and he's always at the senior center too. So I have to speak very highly of Mr. Cross there. So these are some pictures from our child welfare unit. So any report of abuse, neglect, or dependency related to a child is handled through our child welfare division. Our folks spend a lot of time in court. Our social workers spend a lot of time in court. They spend a lot of time on the road taking kids to medical appointments, dental appointments, to visit with their families that they've been separated from. Because the goal of child welfare is to reunify with families if possible. But sometimes that's not possible. And when it's not, then we work very hard to find permanent homes for these children. And so last year, I think there were 14 adoptions done through our department. 100% of the kids that we have in care right now are there because of parental drug use and an inability to keep their kids safe. So that's 100% of the kids that we have in care at this point. But I can't say enough about our social workers. We talk about public safety individuals being out, in bad weather all night. Our social workers are right there beside the law enforcement, and they're out all hours of the night. I get calls 2 or 3 o'clock in the morning. So our social workers, I have to give a lot of credit to because they're out working all the time.
I had the opportunity to go to visit Dragonfly House, and I will tell you those stories are heartbreaking.
Yes.
And the work that those folks do at that facility is incredible.
Yeah.
Very, very difficult situations involving children, and I will echo what you said. There's just incredible group of people across the board, but just witnessed some very difficult situations, and these folks face it as part of their job every single day, having to
Absolutely.
work through that. And that's just an incredible passion that they have to do that unbelievable work for those children.
Yeah, we have a lot of staff turnover in child welfare because of the daily trauma, for sure. But Dragonfly House, even though it's not part of Health and Human Services, we work very closely with them, especially on sexual assault cases involving children. But I can't say enough good things about the Dragonfly House either. So this one, I always get some interesting comments on. I know we're in the prevention business, but the first thing most people see when I show them this slide is the toe tag there and the body. DSS is responsible for unclaimed bodies in this county. I don't know if anybody knows that. So if we have an individual who passes and we can't contact family, can't reach family, they have nobody, then DSS becomes responsible for the funeral services for the deceased, the unclaimed body. So we pay a local funeral home to do the cremation. The Storehouse for Jesus has a burial site on site at a storehouse. So our staff, our social workers go and have a funeral service and bury their cremains at a storehouse for our unclaimed bodies. That's one of the first things I had to deal with when we consolidated, was an unclaimed body. And I thought, because I came from the public health side, and I was like, what in the world are we doing? But now I understand that that's normal process. The other thing that might draw your attention there is the North Carolina fishing license. Most people don't know that we issue fishing license, but we do for those who are on food stamps or are receiving some type of benefit. We only issue to the individuals that that qualify there for those services. But yeah, we issue North Carolina fishing license. You see the investigations of the fraud piece up in the top. A lot of people think that individuals are issued food stamps or Medicaid without any type of follow-up whatsoever. If we get complaints of wrongdoing or misuse of these benefits, we have staff who investigate these. And last year, we had one of our fraud investigators recovered about $250,000 of misused benefits. So we have staff that do that on a daily basis. You see the card down at the bottom for benefits. I don't know if many people know this, but almost a third of the county's population is either on Medicaid or qualify for Medicaid. I know most people don't realize that, but that's a huge portion of this community. You see a young man sitting in a wheelchair and a guy with his arm around him. Like foster care for children, we have foster parents that take care of our foster kids sometimes. A lot of times, our adults don't have that. So we have to find guardians for the adults that need protection. Because we also do abuse, neglect, and dependency for adults. And so when we do, either we become the guardian, and right now DSS is the guardian of 10 individuals in this community, but we have found guardians for others. So just some interesting pieces. We do a non-emergency Medicaid transportation services, and you see the needle and the drugs up in the top corner. We have a licensed clinical social worker who we have embedded in the school system to do a lot of group sessions. It's a diversion program to keep kids in school when they are suspended for any type of drug use. But she is now working with the faculty and staff to do more education with the students and with staff. So while drug use is not a huge problem here, it is a problem, and we're working to address that. We also work with law enforcement, EMS, and other community partners on a community response task force to address some of these issues. So here are some of the questions that I asked the staff, and I won't make you answer these, but so who do you think is responsible for processing birth and death certificates in Davie County, the Register of Deeds or the Division of Public Health? And again, you don't have to answer because I'm going to tell you, but I want you to think through that. Most people say it's the Register of Deeds, and they're not wrong, but the Division of Public Health is the one that processes it first. So we work with the funeral homes, we work with medical examiners, get all the information down, get the birth certificate or the death certificate completed, send it to Register of Deeds, they maintain those. So if anybody needed a death certificate or a birth certificate, they would go to the Register of Deeds to get that. But it starts with the Division of Public Health. All right, another true or false. Rabies control and dangerous dog issues are handled by Animal Services through the Sheriff's Department. So that's partially true. So rabies control for animal bites, animal to animal, is handled through the Sheriff's Department. Animal bites to humans, any human exposure, is handled through the Health Department. However, to test these animals for rabies, they have to be decapitated, they have to be sent to the state. So we work with the Sheriff's Department, we process those heads and send them off to be tested, and then take care of the results and making sure everybody's good. But the dangerous dog, if you have dogs that are aggressive or attack without being provoked, then the Sheriff's Department can deem these dogs potentially dangerous. If the individual appeals that determination, they appeal it to the Public Health Department. And we have a full-blown hearing, just like court. They present their side of the case. Animal Control presents their side. A decision is made. And so we can either support the sheriff's decision or we can go against the Animal Control's decision. But vicious dogs, if one attacks and bites and or kills someone, then that determination has to be made through the Health Department. So I didn't know if people do that either. And that's probably enough to get you started on Health and Human Services, but there's a lot more. But I just want to give you a high-level overview today. If there's any division that you want more information on, I'll be more than happy to send one of our deputy directors out to cover full details on their work.
Great. Any questions?
Yes?
Go ahead, Ray.
Okay. I've got a couple, but we can go back and forth. So my first one is, you've mentioned several times first of all, thank you for the breadth and depth of the services you provide. Wasn't fully aware of that. I'm sure many people aren't. You mentioned several times the collaboration, cooperation with law enforcement, sheriff's office, in your pictures and your examples. I also have been to the Dragonfly House with Christy. I was wondering if you could tell us a little bit more how that works, because I know that it's a model that other places look at in terms of how that works. So I just wonder if you could expand on that a little bit.
Yeah, it's a rarity. When
Yeah.
we go to meetings outside of Davie County or the
Exactly right.
regional or state meetings, and they say, how do you get these things accomplished? I'm like, we work directly with our sheriff's department. And they said, how do you get them to cooperate? I was like, we've never had an issue. And so that's one of the things that I found about this county and these communities, is that everybody wants to work together. They want to help. If they know that there's an issue that needs to be solved, then we're all in meetings together all the time. And Andrew can attest to this, Mr. Meadwell, I'm sorry, Andrew, Mr. Meadwell, can attest to that too, because we work together quite a bit. But, I mean, I don't know how to answer that other than we just do. And the sheriff's co-located with us now. So last week we had an issue with a child. We had an issue with some drugs being issued, and I just picked up the phone and called Chief Deputy Jacobs, or I called the sheriff, and they're right there, and we start working on it. And they've been fantastic to work with. Every department has, to be honest.
I've got a question for you, but first, I want to say thank you again for the magnificent job your agency did with the COVID
Thank you.
vaccination sites. You all did it with such excellence and such compassion. And scary time for all of us, and you did a magnificent job.
Well, thank you for that. It was a scary time, and we felt helpless for so long because there was no vaccine, there was nothing. It was just, we were hearing phone calls every day of people who were struggling or passing away. And so finally, the vaccine came out, and that's one way our staff felt like they could actually do something to help. And so they were excited to get that going. But to go back to your question, as it relates to this, when we got to Parks and Rec, the sheriff just looked at me and said, you just tell me where you want to put needles and arms, and I'll get the traffic flow working. He said, I'll do the rest of it, you just tell me. EMS came out, they gave vaccines. Every department in the county was out there helping in some way, form, or fashion. If we gave 2,000 vaccines that day, before we could order any more and receive any more, they had to be entered into a database. So after we would get through doing the vaccine clinics, we would go back to the office and start entering data just as hard as we could go to get them entered so that we could get more for the next day or for 2 days later. But our Human Resources Department did that. Every department in this county was entering data. EMS was helping us on site. Sheriff's Department was on site every single day. I'm just saying, when there's an emergency, we're in a really good place because everybody pitches in and works hard together.
My question I wanted to ask you about was, you talked about the pregnancy
Yes.
clinic. So how many, are there actually births that take place? Do we have a count in our county of live births?
So we have a few live births in the county, home births, I'm sorry, a few home births in
Okay.
the county, not live births, a few home births. And those are the birth certificates that we do in county, but most of the births take place outside of the
Outside.
county. We have a contract, our OB provider is contracted through Wake Forest, and she comes up every Wednesday. And so we have a prenatal clinic on Wednesday, but for our residents to deliver, they have to go
Yeah,
to Winston.
But so there's not situations where a gal would come in and she's in labor and,
If
You would
so,
just
she would
park them.
probably deliver in the back of an EMS, in the back of an ambulance,
Okay.
because that's happened too.
Okay, yeah, I was just curious about that.
And that's where it's hard to get a birth certificate, because we don't know where she was when she delivered, whether she was here or across the border in Forsyth. So we've had to struggle with that a couple of times too, but we make it happen.
Another question. You mentioned at the beginning that this is what you provide orientation.
Mm-hmm.
I was wondering about staffing. Do you have a ready line of candidates, or like some employers or many employers? Is that a challenge?
Well, we have 130 employees, but right now we have 120 because we have 10 vacancies, and those 10 are the hardest positions to fill. And, but we do struggle to get employees in sometimes. But the ones that we have been with us for quite some time. In the public health realm, most have been there about 20 years or more. That's why those clinics ran so well too. Those nurses knew exactly what they were doing. But our child welfare social workers, they tend to be every few years. But do we have a pool to choose from when they walk out the door? No.
That level of retention says something about the quality of culture and organization that you have. Where do you recruit, and what's your message for people out there who might be interested?
Oh, wow. So I just had this conversation with the county manager a few minutes ago, because we're looking for a pediatric nurse practitioner or another physician to work in our pediatric clinic. And he's like, "Oh, so tell me what you need." I was like, well, first thing I need is to change the Office of State Human Resources. They have a very dry posting. And so if I read that, if I was somebody wanting to go to work somewhere and I read that, I was like, I wouldn't be interested at all. So we have to make that more appealing. But I think our county HR uses Indeed. We send to some of the medical schools. I'm not sure where all they send, because I don't do that piece of it. I just send up the posting, the job description, and they distribute. But yeah, if somebody's interested, please apply. Go to the county's website, davicountyinc.gov. They'll say job opportunities, and please apply.
Great. Thank you so much.
Thank you.
Yeah, I will also add, excuse me, that involved a little bit in the senior games.
Yes.
And for those of you that live in Bermuda Run and may not be aware, we set a record this year in the number of participants in senior games.
Sure did.
It involved every part of this county, Coolamy, Bermuda Run. We had shuffleboard. Councilmember Nelson and I had the opportunity to stand out in the blazing sun and for our first time keep track of shuffleboard, which is a newfound skill that I now have. So I'm adding that to the resume.
That's awesome.
But just wonderful, the scope of what your organization does in touching every part of this county, every individual in this county in some way, shape, or form probably is navigating through. I will also echo the comments about the COVID vaccination. I had the opportunity to be in that line, and I will tell you, it was well orchestrated. It was a well-oiled machine moving thousands of people through that line, and just a fantastic job all around. So thank you for all that you do for Bermuda Run and the county and your whole organization. So certainly, please pass along our thank you to that organization.
I will do
There's
that.
so much that you do for all of us. Many of it's hidden from some of us.
Yeah.
But it's a wonderful opportunity to know all the things that you do, and thank you for spending the time and educating us tonight here.
Absolutely, thank you. And I'll tell you two more things, and then I'll be quiet. So you brought up the senior games. Several of our senior games participants just went and participated in a regional championship.
Right.
There were 5 events, and they blew out every single one of them. They won every single one of them. That was recently.
Awesome.
And then I think the COVID vaccine clinic, the parking piece was too efficient. I told the sheriff, I said, I'm a big girl. I need to get through those lines. You're parking them way too close. So he was very efficient in getting people put in there pretty tight. So it was good.
Again, thank you very
Oh,
much
you're
for
welcome.
tonight.
Thank you.
Have a wonderful
Thank you.
evening. Thank you.
Thank you.
Okay. Mr. McCorkle, we're going to bring you up next, sir.
All right.
Okay. Why don't we move on to the town manager update?
Thank you, Mr. Mayor.
just wanted to kind of brief council on a few things that the town has undertaken. As most of you have probably seen, the flag project is started construction. Couldn't be more happy with the progress we've made. I worried that we weren't going to be able to get our coming soon construction sign up in time, but that's been ordered, and we'll probably have it put up in the next couple of days for that. But a lot of positive interest into that, so couldn't be more happy with that process. Wanted to update council, we have completed our very first phase of the Kennerton sidewalk project. I see Steve back in the back. It was a kind of a trial by error there. I think we learned a lot, but we've got that first phase completed there on North Fork, and we're getting ready to start that second phase. But I tell you, this is one of the success stories of working with the HOA and their leadership and identifying the needs of their residents. I can't be more proud of the success that has. We have been all on the same page, and I hope Steve feels the same way. But as we move forward, I think that it's going to go smoother. Really excited about that and making some really great progress for some folks out there who have, had some issues and worried about, walking on those sidewalks. The trees I'm going to blame them as the culprit, but, just a real success story. Our friends from Smith Grover here as well, they started the hydrant maintenance program in our area. I've seen a couple of their trucks in and around some of the neighborhoods. So this is one of the things that they do on a regular basis to flush out hydrants to get rid of some of the stale water, but also to look at how the flow through those hydrants is being measured too for fire protection. So we sent out the notifications on that, and I think that that worked really well. Cindy helped with putting that message out, cover the bases on that, and so I think just letting our residents know what's going on with their water system. The next update is that that area in Bermuda Run East, around the Spyglass, Gulfview, some of those areas around River Bend, will be participating in a smoke test. That is part of the contract that we have with our AIA, which is our Asset Inventory Assessment. If you recall, we've got a grant from the state to come in and map and find the deficiencies in our sewer collection system. One of the things that was identified in the flow metering of the waste going to our pump station was the amount of, or higher levels of infiltration into the system. So those higher volumes going into our pump station during rain events. So the smoke test will kind of show where we have manholes that aren't quite sealed correctly, or there may be cracks in the sewer line. We sent out an abundance of information. There'll be door hangers placed on those affected residents. You may see smoke coming out of the vent pipes coming out of the top of your house. Hopefully it's going to be kind of a Halloween kind of color. I think they're going to use orange and maybe green right there. So, but hey, if you see it coming out top, if you didn't know what was going on, you would probably be shocked and think something was really amiss. But they're getting ready to start that. We'll say that we have placed, here again, another kind of a success story working with our HOAs. There was a request to look at adding some speed limit signs, especially where the golf cart crossing is there on Bing Crosby. If you look at the area there, the links and the hill there, we went up and took an assessment of it and said, you know what, there needs to be one. But then we also found out there used to be one there, so it made it a lot easier to make that decision. But, you know, working with the HOAs there, and addressing some of these kind of infrastructure type needs is exactly kind of the process that we're, looking at. I will say that, we worked with the Piedmont Triad Regional Council on submitting that application for our EV charging station. They have submitted that to the federal level for that state or that federal grant for that. So we're hoping to be able to do that. We're really excited about having the possibility of having an EV station, 2 charging stations here at the town of Bermuda Run. In our application or our agreement to do that, we just seen that our access to the Blue Heron Trail, to our community events or civics events with the WindMOC and with our recreational facilities that we have, what a perfect way for someone to take advantage of the opportunity for an EV charging station. The private sector has not kind of met that demand here in town. We have 1 charging station at the Hampton Inn. There's some other stations in Moxville, at the Sheets and things like that, but we really thought this was a very cost-effective way for the town to provide a way for individuals to charge their car, but also take advantage of some of our newly constructed amenities of the Blue Heron Trail to get you to our shopping areas and to these other events. The other thing, just to let council know, is that we've received our bids for our leaf collection. We have identified 3 of the contractors that have submitted bids. We want to interview each of those contractors just to get a better understanding of what their approach is and how their equipment and their demand for this operation. Excuse me. Collecting leaves for HOAs and more residential, just regular neighborhoods is quite different than a municipal service. So there's a different level of expectation that needs to be achieved there. We're almost in leaf season, so I know we've all had these phone calls concerning that. It's a difficult task to predict, and most times we get it right, but it takes us a while to get that back on course. So we're hoping that we can find a single contractor that can supply those needs instead of having to outsource to multiple contractors. And the only other thing I have, Mr. Mayor, is the planning board will not meet this month. They have no new business before them. But I'll be more than glad to answer any question that council may have of me of any of these updates that we are very busy going on in the town. So.
Thank you for that. Yep, and I can attest to the fact that the update that Mr. Meadwell just gave represents a small fraction of the amount of activities happening in this town. That we are not at a loss for projects and work, and try to keep all these juggling of all these objects in the air. And kudos to Mr. Meadwell and the team for keeping all these things moving, because it is, and sometimes it literally is a bee's nest of activity. So just thank you for that. Okay.
You ready for me?
Yeah, Mr. McCorkle. So, Mr. McCorkle, first thing we'll do is have our town attorney read to you the, pardon me, the rules and guidelines for our citizens' comments.
Okay.
Excuse me, each speaker shall be allowed a total of 3 minutes to speak, and shall immediately stop when his or her 3 minutes are up. Please state your name and address before speaking, and please address the council as a whole and not ask for any verbal exchange back and forth from the council. It's not the intent of the public comment period to require the council to answer any impromptu questions. There should be no discussion between the speaker and members of the audience. Mr. Meadwell will be the timekeeper and will inform you at the 30-second time remaining spot when your time is up.
All right. My name is Donald McCorkle. I live at 234 Oleander Drive in Bermuda Village. I moved there a year ago, and started remodeling a house, and everyone's invited to come see it. It looks like a museum. They've had bus tours on it. It's been in magazines. It was brought to my attention 4 or 5 months ago that they have real health concerns in the condominiums. And I went over there and started going in different places, the workstations and the pump rooms and the kitchen at night. And I've got pictures and videos of food left out at night, roaches. I've seen mold and mildew. They've had a lady get bit by a bat named Mary McCall. They had another lady that had a bat in her apartment. They caught it. They've got bat feces and raccoon feces up in the attic. And I have gone to everybody for the last several months, including the mayor. He has seen this. I asked him to take and have y'all come in where we could put the pictures up on the deal. For whatever reason, we can't get it done. So I went to the health unit Friday, and they told me that this Susan Wright and Jason White, I believe, I needed to talk to them. They were out. So I went there Monday, and we did put all the stuff on the screen. Well, one of their employees, a lady named Eldridge, went and told Joe Yoon, the manager over there, that I was over there. And so Joe Yoon put a thing on the portal last night, or yesterday, or whatever, saying that someone's been going in these places and they're strictly prohibited. And I got on the portal and said, my name's Donald McCorkle. My telephone number and my address. Anybody that wants to see these pictures, give me a call. And the people are in danger. They're old people, 70, 80, 90 years old, and they're breathing mold and mildew, bat feces, and raccoon feces. It shouldn't be any of my business. I don't live there. But if an orphanage was burning down, I would call the police. I would do whatever I could. I'd call the fire department. For whatever reason, for 3 months, I've been ignored. That's all I need to say. Somebody needs to do something. If I got to go to the television station, that's what we'll do.
Thank you.
Thank you.
Okay. Moving on to mayor comments. Pardon me. So as a reminder to everyone, we do have a vacancy on our council. I have had some people reach out to me about this vacancy. If you have the time and the energy and the passion to serve, I encourage you to please reach out to me. Would love to have a conversation with you. Ultimately, I believe the most effective council is a complete quorum of a council. So thank you for that. This month, we have 2 concerts coming up. So we have this Saturday, we have the Special Occasion Band on the 14th, and then at the end of the month, we have North Tower Band, excuse me, on September 28th. Pardon me. So I'll, excuse me, I'll have Christy speak to a little bit about the 25th anniversary in just a moment, which coincides with the 28th. So we are making good progress on our land use and zoning project. Those of you that may remember, we began this journey right after we published the comprehensive plan. We went through some changes a little over a year ago. Those changes were approved in January. The group continues to work now with Benchmark, Planning Board, council members, myself, and Mr. Meadwell. Those changes ultimately will affect our comprehensive plan, excuse me, our future land use, zoning ordinance, and our zoning map. So a lot involved in those changes. We are looking to complete those final drafts in early October and hope to have this information to the Planning Board potentially in October for review to begin that process of moving those changes through the system. For next month's Town Council meeting, I have invited Miss Jessie Elmore from the Habitat for Humanity, located right over here in the Bermuda Quay Shopping Center. Looking forward to hearing her present. If you remember, those of you who were here, we had Habitat for Humanity speak a year and a half ago when they first came to Bermuda Run. So this is an opportunity for them to give an update on all the things that's happening there. With that, I'll turn it over to Councilmember Schaefer, who's been leading the effort on our 25th anniversary celebration, to give an update on those events.
So we have a luncheon on the 27th for former mayors, council members, planning board, county officials, state representatives. It'll be a nice event to look back on the history of the town, and there'll be a video that's being produced right now that'll be an archival piece for the town. I think it'll be a really nice event for those that has served early on. So many, unfortunately, have passed, but we do have some that have some real wonderful stories about the very early days of incorporation. And then that evening, we will follow with our Food Truck Friday, but it'll be a celebratory Food Truck Friday. The Community Vision Fund Committee has prepared some really terrific activities going on for children. There'll be balloon and magic and games for the kids. There will be some enhanced lighting that evening because we're losing our daylight. Summer is winding down. We will have our food trucks. Jason's Italian Ice will be providing free ices, and we'll have cake from Maddie as a celebratory birthday cake. And of course, we can't forget our favorite house band of Pushin' Georgia. So it'll be a fun evening, 5 to 8 p.m. on the town square, followed Saturday night by the North Tower Band. And there'll also be some wonderful little birthday celebration activities for that night. There'll be cake and some odds and ends, and we'll wrap up the celebration. Hope you love the celebratory banners hanging around town. They'll hang up through the end of the year, and it just is a really nice way to celebrate 25 years.
Thank you for that. Yeah, and everything that Christy described, we're communicating through social media. Certainly, if there's anyone out there who, for whatever reason, doesn't get social media, please pass this along to them. The 27th and 28th is going to be a wonderful weekend of events and celebrating our town, and hopefully everyone can come out and enjoy and celebrate along with us. So thank you for that. And thank you to Christy. Thank you to Ray Nelson and others who are working a significant amount of work around this whole project to pull this whole thing off. A few of us get to just show up at the end and wear a suit and tie, but I appreciate all the hard work many volunteers are involved in doing this. So thank you for that. With that, do we have any other comments from council? If not, do we have a motion to adjourn?
So moved.
Second.
Motion by Mr. Ernst, second by Ms. Nelson. Show of hands. Council 3-0. Thank you all. We are adjourned.